mic. I don't want to turn.
So I'm going to
The shine one? Yeah.
read for a brief statement.
Sorry, can I put the mic, please?
Just turn it.
Yes, sir. Thanks.
All right, so
Turn in it.
the sort of major interest in why you are here and the interest right and then I'm going to ask the medical chief of staff at University Hospital of West Indies to elaborate. I just want to say categorically, based on the advice I have, that there's no truth to the claim that there's a case of the new coronavirus at the University Hospital of the West Indies. Dr. Bruce, who is sitting to my right, I'm going to ask him to elaborate on the issue that is at the University Hospital, which may have been or would have given cause for the increased levels of discussion and question. Dr. Bruce.
Thanks so very much, Minister. Good afternoon, everyone. As the Minister said, I'm Carl Bruce from the University Hospital, Mona. I think you would have been here because of what I gather was discussion on social media about a particular patient who we saw at the University Hospital this morning. The patient was transferred to us from another hospital, and the doctors at the emergency room at the University Hospital evaluated this patient. In evaluating the patient, because the patient had a history of travel to Asia, in China specifically, the team, rightfully so, considered whether or not one of the differential diagnoses, as we say in medicine, should be considered this viral outbreak that you have seen internationally. The patient does not meet the case definition of the coronavirus, and maybe PAHO and the ministry will comment on that afterwards. But out of an abundance of caution, the doctors just wanted to ensure that they discussed this. The patient is doing well. The patient does not have a fever above 38 degrees, as by the case definition at this time. And the University Hospital will continue to do the evaluation and testing, and will discharge the patient home as per our usual protocol as soon as all of those testing and evaluation are completed.
Okay, thank you very much, Dr. Bruce. I should have started by introducing the person sitting here, by the way. Dr. Gandhi is the country rep for the Pan American Health Organization. I introduced Dr. Bruce already, and Dr. Webster Carr is the acting chief medical officer here in the ministry. Permanent secretary sitting over there to my extreme right. So that's the position of the medical team at the University Hospital of West Indies. And I want to just read a brief statement, but just add to what he said. I'm giving up a statement to Parliament today, coming on the heels of a discussion yesterday at Cabinet. We take this issue very seriously, and we believe it is better to err on the side of caution in terms of taking a very proactive position. And I am prepared to say that I suspect that is what the university did in terms of evaluating and assessing and considering all options as it relates to this particular case. So in terms of the later today at 2 p.m., I intend to give a more comprehensive statement, but since I have you all here, and we call you here because it is almost as if it was national panic coming on the heels of the discussion in the social media world and otherwise about this possible case. We decided that we would not wait until the parliamentary statement was read. But that statement will be done, and greater elaboration on the government's approach and action will be discussed. But in terms of our preparedness for the coronavirus, we have had discussions, as I said yesterday, at Cabinet, and we invited the Pan American Health Organization rep to be there, and she was there and commented on the issue. The technical team of the ministry was also present, and those discussions considered the nature of the virus, challenges as it relates to the spread or potential threats, and what we needed to do to make the appropriate levels of preparation. Since this morning, prior to this press briefing, I had a meeting with my team with the Ministry of Foreign Affairs, with the minister, with also the Chinese ambassador and his team. And based on those discussions, the government of Jamaica will continue its collaboration and its surveillance protocols, which are in alignment with the international health regulations. We will also continue our active surveillance at our ports of entry, our airports, and other ports of entry. And we took a decision coming out of the consideration at Cabinet and subsequent discussions that a travel advisory would be issued where persons in China who are planning to travel to the island will be advised or asked to remain in China. Where persons who were planning trips to China, whether Jamaicans or Chinese, we are advising them to postpone, at least for the time being, those travel arrangements that they would have made or are planning to make. For persons in transit to Jamaica, or quarantine protocols will be put in place, where persons will either be quarantined in facilities, specially designed facilities, or within their home environment, depending on the particular circumstances, and depending on the risk assessment that would be done. The nature of the virus suggests, based on the experts, that there's a 14-day, 1 to 14 days for gestation. And so the quarantine arrangements would reflect that consideration. For families who are concerned about their relatives and friends in China for work or study, our conversation with the Ministry of Foreign Affairs indicates that plans are in place through that ministry to ensure that those persons, whether students or otherwise, our concerns are dealt with, or certainly are represented in that jurisdiction. And later today, after I complete this meeting, there is another meeting at the Ministry of Foreign Affairs, which will involve our key bilateral partners, where we will have a discussion about this issue, and any possible coordination that is required as it relates to travel via a third country from China to Jamaica or otherwise. That the meeting will take place at 1:30, not too long from now, at the Ministry of Foreign Affairs. So this represents the substance of the government's position. We continue and will continue to be vigilant. We have been monitoring the information out by other countries that are affected or trying not to be affected, coming out of China from the authorities, and certainly from our multilateral partners, in particular WHO, in terms of what they're advising. Similarly, so the CDC, Centers for Disease Control, has put out a statement giving some advice as to how we deal with this issue. Our first interest is the protection of our citizens, and
So, Well,
Yeah.
there you had it. Minister Tufton talking about addressing the coronavirus. We're trying to get back some audio from the minister now, but until then, I mean, if you need any information about what was said by the minister today and more information about things happening regarding the coronavirus, it's jamaicagleaner.com or any other RGR Communications Group social media pages. You can always find information there, and we're keeping you updated as things happen. It's good to know that it was not a case of the coronavirus. That's good to know. As the minister said, stay, if you're going to err on the side of caution, so
Yep.
still take your precautions.
Stay
and
vigilant.
Stay vigilant.
Yeah.
The government has agreed and has put this in place, which we will elaborate more on later on in Parliament. Okay? Any questions?
The C virus we're talking about.
Well, my brief is that we do have stocks to provide that level of support to our staff members. But again, out of an abundance of caution, my understanding, and the CMO is here, we have made provisions to increase the inventory of protective gear should we need it. So we don't get further on that. That's really what it is. Yeah, what else?
I'm from Ari. My name is Shelley Gibbs. What is the status of the lab? Can you give a quick test me?
As of today, if we have a sample to be done,
Could you just hand in the recorders to close some please? Thank you. And kindly introduce yourself. Please.
Go ahead.
Karen works with active treatment. So, as of today, if there's a sample, it will either be sent to our collaborators in the US, CDC, or to Canada, Public Health Canada. The PAHO has indicated that they will support the National Influenza Center to have the facility to test in a short time. So we will be able to test, but it's a new virus and the testing capacity is outside of the country for now.
I'm Emma Lewis, I'm a blogger, and I would like to ask Dr. Bruce, you're still doing tests on this patient. What is do you know?
Yeah, so there are many patients, as you know, who can present to a hospital with a respiratory viral illness. We have to consider all the usual things, including flu, influenza, dengue, etc. In this case, the only reason why this has come up is because of the patient's travel from, and that patient would have traveled to China on the 7th and returned via New York from the 13th, 14th of the month. But that is just how hospitals operate. They try to get all the possible details. And as we said before, out of an abundance of caution, we just wanted to make sure that that was considered. But certainly it does not fit the case definition. No.
May I just ask a follow-up? My name is Damian Mitchell from the media. You said as of today there is a sample.
No, if there is a sample,
If there is a sample.
if there's a sample, we would send it abroad.
Okay.
Shabala Pulen from TVJ. Do you plan to increase public health personnel at the airports and also in terms of digital thermometers? Do you plan to give them digital thermometers?
To address that. We can talk about the thermal scanners.
Okay, so with respect to thermometers, we have the wall-mounted thermal scanners. Or if you didn't know, you know now. We don't really recommend the personal touch. So what we have is the handheld scanners. And while the one at Norman Manley provided by health was stolen. We do have access to the others at the airport. So there is thermal scanning done as well as handheld scanning. There is that possibility if we need it. So we are working to replace the ones we had in health. So let's look at why the public health personnel is there. So everybody coming in, the immigration is responsible for the security of our country, including public health security. The persons will be referred to the health desk if needed. And if you have been through the airport, you do notice that the public health nurses walk the line and just check your immigration particulars to see if you gave a history of coming from any place of interest. And so the staffing that is there at the moment is adequate because it's a referral system. And many of us travel elsewhere. Have you ever seen public health persons from any other country? You are referred. So you are questioned by border security and then referred as necessary.
Last night in our newscast, NAG was saying that it's a challenge in terms of the numbers that they have at the airport, which probably that needs to be increased as well as the recipe to the digital thermometer saying that they're using the analog one. So my questions were in relation to those concerns, those issues.
I understand. And we do not, at this time, we prefer not to touch the patient if we're thinking they're infectious. So we don't even propose to use the digital thermometer as you know it.
And if the president said only 2 public health nurses each shift, and she raised a concern about flights coming in with 300 passengers in this week, how do you get them to the airport to get them as quick as possible?
Yes, so you want to catch everybody, and we land everybody. Who is the person who land everybody? And so the referral system is what we have to depend on. Okay?
All right, yes.
Just on the travel advisory, how long will this travel advisory be in effect for?
So the intention is until further notice, because this is an unfolding event and one has to monitor, consult, which is why we have had several meetings and will continue to have these meetings, both with our bilateral partners, with the Chinese authorities, with our multilateral partners, PAHO, WHO. So we think that at this point in time, given the traffic between China and Jamaica, which is usual at this time because of the holiday period, as well as the concerns that have been expressed within China by the authorities in terms of restriction of movement, we need to also do what is necessary based on our own risk assessment. And we think coming in from China now should be avoided, and going into China should be avoided. I want to make it clear, too, because Jamaica is international in its openness, tourism industry very vibrant, that Jamaica is open for business. We're not suggesting at all that others should adhere to a restriction from visiting Jamaica. In fact, Jamaicans and our foreigners continue to enjoy all the pleasures and privileges that they're entitled to once they visit. But as it relates to the challenges in China, those restrictions are specific to that. I think that's important. Well, this is the first time I'm announcing it. I will do so in Parliament and the appropriate, and this is in having advised the Chinese ambassador, having had a discussion with him this morning. Yeah. Right, right. Well, I'm being told that I should say strongly advised.
Mr. Tufton, Shoshana Small from West Caribbean. So the travel advisory is for the defense for China, but there are also cases in America and England.
Right. So that is why I indicated that we are going to be having discussions with our bilateral partners, our major bilateral partners. That meeting will take place shortly after this one. And you know the main ones, right? European Union, Canada, the US.
Simone Absalom from TVJ. We just had a really historic launch with the cruise ships coming in to Port Royal. I wanted to know what plans do we have in place for all the ports of entry that are not necessarily coming into the airport?
Well, as I said earlier, we have to distinguish between our normal course of activity, including the tourism travel, from what we have announced as it relates to China, traveling to or from China. We will continue to be vigilant, and indeed will step up the pace of our vigilance at our ports of entry, which would include our ports. And that is an ongoing process. Our medical team on the front line would have been briefed and would be kept brief based on the information that we get. But beyond that, we are not in any way, shape, or form advising of any restrictions or travel advisory as it relates to other jurisdictions. But we will continue to coordinate, as I said earlier.
And I also wonder, what about other persons who have come into the island from China in the last
Right.
year?
You know, yeah, I missed saying that, and I'm happy you asked that question.
Yes, sir.
For persons who have returned from China within the last month, the ministry has begun a process, and I believe we could use this mechanism to provide some support for that process, to track where we can those individuals, and we would ask those individuals, if they are not contacted, to make themselves available either to their private physician or the public health system, because one of the other things that we would like to do is to do an assessment of those persons who have recently come into the island from China, either via third country, because they have to go via third country. And we're thinking about the last month. The last month. Any other questions?
Just a clarification. You said samples will have to be sent overseas for testing for the coronavirus. So, what criteria did you use?
Bruce, that's your...
So, I don't know. So, as I said before, there is a case definition for the coronavirus. So it's not every illness that you see in hospital that you're going to say, could this be? You have to compare the patient to the case definition, and we have our experts here, Professor Boyne, Dr. Azinger from the lab, Dr. Alison Nicholson, and our CEO. We met this morning, and we looked at the case definition again, and we would compare what a patient has with that case definition, and this patient falls outside of that case definition.
That's it? Are you adequately addressed? Huh? Okay. You must understand that this was not a planned press briefing, so I'm consulting as I go along because I want to be responsive and not be accused of ignoring the calls of the media. No, I'm just being told by the PS that there are some thermal scanners that are going to be deployed based on what we have in inventory to boost the capacity of that instrument.
You want to go, Karen?
Get ready.
So the case definition is an acute onset of a fever and respiratory symptoms, and with a travel history to a place that would have active transmission. So first, we would have to complete the fever. The person did not have a fever. The travel history was to China, but in a place where this was not circulating. Also, we are just outside the incubation period, which is 2 to 10 days normally, but may extend to 14 days. So the person would have left China on the 13th and arrived here on the 14th. So today is the 28th. So we are just outside, because they would have left China on the 13th. So we start counting on the 13th, yes? And so we are outside of that period. So persons get ill for other reasons. So UWI did the correct thing, and they alerted, and they, but at the end of the day, it's not a suspected case, and would not make the requirement to send in that sample abroad, because we could not send it. They would not receive it from us, even if we tried to send it. Just, we just want to make sure, we want to tell the public this is not it. And that's not how it works. And so we would not even be able to send that sample.
So it's a process of risk assessment.
Okay, so it may be a few days to get the result. First of all, we have to transport it to the site that will test, and based on their turnaround time, we will get the result. Pardon me? That's the possibility. PAHO would. I don't know if do you have a time yet?
Jamaica is very fortunate in having a national influenza center, and PAHO WHO up to the end of last year was doing training with the laboratory and the national laboratory and the national influenza center. So we know that in terms of information systems and capacity, they were up to speed. WHO is expecting that we will be able to send the specific reagents to all of the national influenza centers within approximately 2 weeks, and then the local national influenza center should be able to conduct the necessary tests locally. We'll also be sending the test and the reagents to CARFA as well. So both the National Influenza Center here in Jamaica and CARFA will be getting those reagents at the same time, and we will have the capacity to test.
We do have Dr. Alison Nicholson from Microbiology, Infection Prevention and Control, and Dr. Azinger here. So afterwards, if you want any specific questions regarding how the process takes place in terms of testing, you can consult with them, but they are here.
One quick question. You did say that the patient did not present the case definition for SARS. What did the patient present?
I'm sorry.
You did say the patient did not present what you call the case definition.
With the case definition.
What
Yeah.
did the patient actually present?
Yeah. So I understand that you want to get details. We have to respect our patient's privacy. But in this case, the patient did not have a fever over 38, and the patient did not have the respiratory symptoms that are discussed in the case definition.
Sorry, you're not answering the question.
Yeah, because
or where the patient is from. I'm asking what symptoms did this patient, this one out of 4 people in Jamaica, present?
Yes, and I am saying to you that we have a case definition, and the patient did not have that case definition. So I think we'd rather not divulge the specific patient's symptoms, sir.
remember now, it's not a matter of there are certain protocols that governs the confidentiality around patients and their treatment. The truth of the matter is that you didn't request a name, and I appreciate that. But the attention given to the university hospital since this news broke could create a scenario where that patient could be identified or revealed by some way, shape, or form. We're trying to avoid that. I think what is most important is that the clinical team, and there are several of them in the room, not just Dr. Bruce, he just outlined a few others, and you can have a conversation with them after. What I'm relieved about are two things. Firstly, that the university team acted responsibly by assessing the risk, given the travel history of the particular individual in question. And secondly, of course, that they were able, with their combined capacities, rule out that the coronavirus exists. Now, we're a little disappointed that we made heavy weather of it in the media space so soon, because it has certainly turned the country into almost a panic mode. I understand the issues, I understand the need for concern, but it was important, I think, and it is important now to clarify that this is in fact the case. I want to mention one other thing quickly, and we're going to have to wrap up shortly, but the discussions this morning with the Chinese ambassador and his delegation at the Ministry of Foreign Affairs and Foreign Trade was a mutually respectful one. It was open, it was transparent, it explored all the possibilities. It recognized the friendship that Jamaica shares with China in a number of areas, both in business, culture, and all the other areas that are good for both countries. Education, we have students there studying, the Confucius Center, we have Chinese here teaching our own locals. And the decisions taken around the travel advisory are based on that recognition of our friendship. And I say that to say I do not want this to be interpreted in any way, shape, or form as a hostile position. And indeed, I would go further to encourage us not to use this opportunity or this position currently, and I mean us in a broader sense, to take any position that may be interpreted as being discriminatory to our Chinese nationals who are currently in Jamaica. The risk is recognized on both sides, and what we're trying to do is to cauterize and to manage that risk. But it makes no definitive statement or no statement at all on the quality of the friendship that we share. And indeed, the ambassador has asked me to extend his own appreciation for the discussions and the positions that we have taken in the interest of all concerned. Okay? Any final question, or you can pick up after? Okay, final means one, but okay, two, after that no more. Yes?
I'm Kenny Stein from the Jamaica Observer. I remember at the time of the Ebola outbreak, there was a quarantine facility being set up at the National Chest Hospital. Can you speak on how equipped and the capacity that can accommodate in the event that the virus gets here?
You want to speak generally on quarantine? Because there are different elements, isolation, different elements. Yeah?
Okay, so all health facilities have some level of isolation, and because of how it is right now, it will be treated at the major hospitals that we have. The facility at National Chest would not be used immediately, but we are revitalizing that matter. All hospitals, because of how it's transmitted, it can be treated at all our hospitals, and there are isolation facilities at our hospitals.
Can I just say something, because I hear the question. I didn't respond to Shamela's inquiry about our health personnel at the ports and equipment and so on. And I think it's a valid concern that is raised, and we appreciate when these things are raised in the public's interest. But let us not forget that Jamaica as a country, with its existing infrastructure, existing personnel, have done what is, I believe, a remarkable job in managing external health risks. We managed to keep yellow fever out, malaria out. I mean, obviously you have a few cases but not to the point where it becomes a crisis. We had the SARS virus. What's the other one called? The MERS virus, which are all comparable, at least in terms of the novel virus, meaning a new virus, to what is now the case. And we have been able to overcome those risks. And that's because we have a fairly resilient system. Our personnel are adequately equipped, or they make themselves so in the case of new threats. And I am sure we will be able to manage this one. Now, I am not saying that there aren't margins of error and that you will always have a risk of an imported case. We have to prepare ourselves to deal with it. But I don't want the population to believe that we are less than adequate, if you will, to both study, understand, and address the issue. And we are making these statements because we think the public must be kept informed, and we have tried to be as transparent as possible in so doing. Okay? Thank you very. Oh, yes, I promise you.